Hi, I'm Kathryn Jean Lopez from the National Review Institute and National Review Magazine in my very messy office in New York. Um, and I have here my friend Charlie Camosy, who is a moral theologian. He teaches ethics and moral theology at Creighton University and at St. Joseph Seminary in New York, and writer of many books, and a good friend. Charlie, thank you for joining. We wanted to talk about, we have a lot of things we could talk about, but this study that came out from the Ethics and Public Policy Center yesterday, taking available insurance information, they found that that abortion pills are more harmful than we've been led to believe by the FDA. 1 in 10 women who have used the abortion pills have had adverse effects. That's a lot.
Yeah.
Of course, some people I saw on social media commenting, well, a, a pill regimen that is the object is to kill a baby would be harmful on its own. Yes. But this is the kind of issue where if you care about women, we can almost set aside the abortion debate for a moment and recognize, all right, this isn't even safe for the woman. Can we talk about this, and can we talk about regulations and rolling back the widespread availability? Charlie, what's your reaction to the whole study?
I guess the first reaction I had was that this is something like vindication for those of us who have been saying for decades now that when our opponents on these questions say things like it's just as safe as taking Tylenol, or the FDA saying there's a 0.5% incidence of severe and difficult events for women, that just didn't register with our experience. We have had so many people in the pro-life movements over the decades had so many experiences of women and families connected to women, people connected to women who've had these adverse effects that just didn't ring true with us. And there have been a few studies here and there which have shown that that's probably true, but this is undeniable evidence. We're talking about 100, or I think it's 860,000 abortions were in
Right.
this database. Um, and we now know that something like 22 times, it's 22 times more frequent a serious adverse effect or event happens for women than the FDA tells us. That is simply extraordinary. That's bananas.
Mhm.
And it's a total game changer. And I mean, just think about it this way, Kathryn. The rate at which they found there was a tubal pregnancy, right? In these cases, which is extremely dangerous if you have a pregnancy inside the fallopian tube to take the abortion pill. The rate of tubal pregnancy that they found, and for women that had taken the abortion pill, was almost all by itself enough to meet the FDA threshold of 0.5%, much less sepsis, infection, hemorrhaging, ER visits, all the rest, right? And so this is a game changing study. It's a game changing study.
I was talking to, we should be quick to say we're not happy that this is confirmation. Um, it, it's it's so frustrating because there have been alarm bells that have been raised since the beginning of the introduction of this. And I was talking to a woman who had a very complicated pregnancy, and these are the kinds of pregnancies that get lost or lied about, where she had to have a medically necessary DNC that didn't work. And then anyway, I don't know all the details, but the point is she had to use this regimen. And she said, this is not a light issue. And these girls, in so many cases, we're talking about girls in dorm rooms who are facing this on their own. Before we went online, my new rant. I mentioned this when I was talking to Jarell Godsey from Heartbeat International yesterday. I've been My eyes are going because I've all the decades of reading and screens and everything are doing damage. But I cannot buy these glasses. They're 3.0 magnifying strength, whatever that means, in New York State. I had bought a box of them at Marshall's in DC, and I wanted to buy another box just because I break them and I want them around. And I went to Amazon and I could not purchase them to a New York address because it is illegal in New York State to buy these magnifying glasses, basically. But you can, by telehealth, get the abortion cocktail, the two pills, and that that's a reality I really don't believe people realize is reality. And because I don't think we're that callous a country. I think we may be indifferent, but I don't think we're that callous that we actually want women to be being prescribed abortion pills over the internet. And we have a case here in New York where a doctor sent pills to Texas, and of course the leaders, political leaders in New York, are all for that. So the mainstream media isn't covering this groundbreaking study. If we cared about women's health, we would be concerned about this. We were talking earlier about, I'm reminded about when the Kermit Gosnell travesty was in the news. He of course was a butcher, and he's in federal jail now. An abortionist who it was just the house of horrors, essentially, as people who saw the movie that was eventually made are well aware. But I remember during that time there were it was Molly Hemingway and Kirsten Powers in particular were sounding the alarm. I mean, we were doing it too, and there were others. But I remember one day Kirsten Powers on Fox News, Brett Baer's show, and she said, this is a moment where, and I'm paraphrasing, but this should change us, because we're aware of something, and these are the consequences of, not basically turning a blind eye to recklessness in this industry, because it's so protected politically. And she said, this should change us, but it won't. And I remember at the time thinking, but it has to. And it didn't. And this is another moment where people need to be aware this is happening. And I have to believe that if they knew, they would. We don't march. I feel like conservatives don't march on Washington enough. But this is the kind of thing, like, we want to protect young girls and women, right? Um, Anyhow, do you have any practical hopes that this will make an impact? I mean, I'm looking at the Trump administration right now, and Jay Vance in particular, who has said some things that were very troubling, actually, about the abortion pill during the campaign. Um, I would like to see him and others step up to the plate and take another look at these pills and the accessibility.
Yeah, as you know, Kathryn, I've spent a good deal of my time, both as an academic and as a pro-life activist, trying to build consensus across all kinds of difference on this issue, including, and you and I have worked on this in many contexts, social support for women and others who need it to try to keep their children, social support for those that want to preserve their children via adoption and other means. Um, this is yet another one of those examples.
Mhm.
I mean, how many times have we heard over the last 5 years, especially, people say, I have a position on this because of I care about women's health, a pro-choice, pro-abortion position saying, I care about women's health. That's why I have my position that I have. And so let's just take them at their word that that's true. Now, for some of them,
Right.
it's not true. But for many people, I think it is true. Um, this data plays into that principle in a very clear way. If you care about women's health first and foremost, then we just simply have to go back to the kinds of restrictions that we had on the pill, the abortion pill, under the Clinton administration when it was first released. As you know, it required originally 3 in-person doctor visits. It included mandates that the drugs be dispensed and taken in a doctor's office. There was a required follow-up. And if there was an adverse event, it had to be reported. Every single one of those requirements is now gone between the Obama administration and the Biden administration. Every single one. So as you mentioned, you could have a so-called abortion doula who you find randomly on Google, um, spend 5 minutes with you and send on a telehealth visit and send you these pills, which we now know have these incredibly high record of adverse events. That is bananas again, totally bananas. But for people who aren't ideologues when it comes to abortion, and that's most people actually,
Most people, right?
most people are not ideologues.
Including
Mo
people who describe themselves as pro-choice. They want to
exactly,
know
plenty.
that women in difficult situations have options.
That's right.
Me too.
And if we could go to the tens of millions, dozens of millions of people who are in that complicated space who say that they're pro-choice, but but have these complicated views, I just have to believe, maybe I'm naive, I have to believe that if we could say, listen, we're not trying to ban the abortion pill, though of course we'd eventually like to get to that point. We're so far away from that ever happening, and I just don't even
Right,
know what
right.
we're talking about. If we could just say we want to go back to what the original Clinton administration said. We want 3 in-person doctor visits, including required follow-up. We want the pills to be taken in the office, and we want a record. We have to be able to have a database so we don't have to go through this rigmarole of adverse events so we can see what's actually happening here. I maybe again I'm naive. I just have to feel like the dozens of millions of people who identify as pro-choice but have complicated views would support something like that.
And you just have to be a human being and think about it for a moment. Um, Not only the physical possibilities of complication, but the mental repercussions of 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 seeing your pregnancy end in your bathroom. Um, that you're not physically present with medical um, personnel is insane. As you say, bananas, right? And cruel, cruel. This is
Cruel.
cruel. You have a son to pick up, so I want to move on to New York State on the other end of life.
Sure.
Because it we are closer right now to legal assisted suicide in New York than we've ever been. And this, among other things, I mean, talk about cruelty. One just needs to look over the border and see what's happening in Canada, where they have what we're supposed to call medical aid in dying. That's the euphemism for it now. And we have homeless people who are being prescribed death because that's easier than helping them get on their feet. Um, Many illnesses that are not grave or are not immediately grave, that are being prescribed this. And the timing of this is amazing to me because, as you've written a book on this, um, Pope Francis, who was quite beloved the last week on media from politicians of so many stripes, it, assisted suicide is a slap in the face to everything he talked about. You focused in one of your books on his language about the throwaway society, disposable culture. Um, I remember one night. I'm sorry, Charlie. I was leaving National Review in August because I still remember the smell, and there were piles of garbage. And I took a picture and sent it to you. And I said, look, it's the throwaway society. And we can laugh about it. I mean, it was disgusting. But, the New York City streets, they have to collect the garbage. Um, but when you think about it, we do that to human life too. And when we think of New York State and the end of life, we think of COVID. And you were sounding the alarm very early, warning people that there would be corners cut and lives that would be decided that they weren't of as much value as others, which is exactly what wound up happening. And I think often of the poor doctors who were in those nursing homes trying to do triage, and that was impossible. And so, Charlie, is there anything that can be done about this?
On the one hand, I want to say yes, because I just have a new book coming out on this very topic with our Sunday Visitor Press. It should be out in August, the title of which is Living and Dying Well, a Catholic Plan for Resisting Physician-Assisted Killing. And in that book, I spend the introduction and first chapter basically saying, though there's certainly a mix of results over the last several years, there's actually a lot of reason for hope, particularly in the Northeast. So we have these deep blue states like Connecticut, Massachusetts, Maryland, I'll say New York with the caveat about what we're talking about here, who have for years now, over a decade in some cases, again and again beat off Compassion and Choice's attempt to pass this. Compassion and Choice is, of course, the main organization responsible for lobbying for physician-assisted killing, which used to be named the Hemlock Society,
Hemlock
right?
Society, yeah.
Yeah, yeah. Whoever made that decision in their board meeting deserves a medal from their standpoint, right? They made a good decision to get rid of that name. Um,
Although the Hemlock Society focuses the mind on what we're actually talking about.
right, right. I'm just talking about if
Yeah,
it was a
yeah.
good PR
Good
decision from
marketing
their,
move. Yeah,
yeah,
yeah.
good marketing move. But you're right. That's why I find the term medical aid in dying so pernicious. It's a classic example of throwaway culture where you change the language, you change the name to make certain kinds of populations easier to throw away. You turn certain populations into the kind of garbage that you took that picture of to make them easier to throw away, which is one reason why um, there actually has been this hopeful reaction. 9 years in a row resisting in
Yeah.
Maryland, 9 years ago, 9 years in a row in New York, 13 years in a row in Connecticut, Massachusetts again, because these disability rights groups come to the hearings and they say, you are creating a law which will turn people like us into garbage to be just thrown away.
Right.
And Kathryn, that has won the day again and again and again and again. So I felt really hopeful in that book. I say, this is by no means a done deal. We've fought this off for so long, but here we are in this reality in New York State where it looks like, though we don't know for sure, that they may have the votes to pass this. It may come down to whether we can convince the governor to take a different look at this. I think I'm going to try to put together an op-ed for the Daily News on this and just make it appeal directly to her and say, if you care about disabled populations, if you care about poor populations, if you care about populations of color, these are the populations which are extremely, extremely opposed to physician-assisted killing. Physician-assisted killing is overwhelmingly rejected by the most vulnerable populations for reasons we can just imagine. It's really a product of the most privileged that push this again and again. And so it makes sense in a way that the deepest blue states in the Northeast have resisted it for this long. It's really a triumph of a kind of consumerist, elitist, throwaway culture if this goes through in New York.
Yeah, and I think about, I mean, how pernicious it can be in all of healthcare. I thank God that my elderly mother has doctors who care for her to stay alive. You know, that's not a given. The more we pass physician assisted suicide, the easier it is to, you know, make the economic case against a little more care for someone who is obviously in the last chapter of her life, but just needs basic health care to keep going. And I do take hope from the fact that Andrew Cuomo didn't let this get a vote in committee even while he was governor. And I do think that and I've got some rants in me that Joe Biden today has an op-ed in the USA Today talking about Pope Francis and his compassion and his mercy and care for human dignity. Of course, words like mercy and dignity have been perverted by Hemlock Society types. But again, you're missing the point of Pope Francis's message, including the fact that he met with the Vice President of the United States in his last day of life. If there couldn't be a clearer message of, okay, here is an elderly man who is suffering, who we now know was dying, and yet he still has value. He still can meet diplomatically with this man. But also, if you took a look at the video we saw, obviously JD Vance was moved, and obviously, there was an element of him where, baby Catholic was meeting his spiritual father, and you saw some appreciation for this is an elderly man who's suffering.
Right.
And not, oh well, this is an old dude who's irrelevant or not worth my time, right? It was such a beautiful, I thought, farewell, going out in the square that last day as well. Life, and even if he couldn't do that, we remember the last days of Pope John Paul II, who couldn't go out in the Pope mobile, and we saw him so so clearly suffering and receiving his end, with as much grace as one can when you're losing your basic faculties, right? George Weigel talks about that being his last encyclical. He didn't write it; he lived it. And there's something similar in those last days of Pope Francis when he came back from the hospital, where he was showing, hey, yeah, I this isn't my prime here, but I'm still a human being, and I'm still Pope, and life has value, and life has meaning. And I thought it was providential that when he first went to St. Peter's Basilica that first time when he left the hospital, he met this 90-year-old nun who was on pilgrimage because it's a Jubilee year, the Jubilee year of hope. And so people are going through the Holy Door at St. Peter's Basilica. And the Pope wanted to do that before he died. And so he did, and he met this elderly nun, and they just had sort of an elderly pilgrim meetup, impromptu. And that's the stuff of life. And we when we see that, I think we're reminded that, yeah, there are better choices than putting elderly people away in facilities and forgetting about them, or
Right.
worse.
Or
And
worse.
and that worse is what we're talking about. And thanks be to God for those in the disability rights community who have been courageous voices, truly. And I think in New York, I keep thinking today about these days since this has come up, because it was kind of a sleeper issue. It was quiet. But I think Compassion and Choices have been working behind the scenes with a lot of money, but not publicly. So we kind of thought we could get away with another year without assisted suicide in New York. But here we are. But I do think that when people, so I'm thinking of J.J. Hansen, who was outspoken. He had brain cancer. He had that same brain cancer that Brittany Maynard, who traveled to Oregon, right? I think it was, yeah, to kill herself, because it was legal there and it wasn't legal where she lived. And People magazine put her on the cover. This was celebrated. Meanwhile, JJ didn't want to avail himself of assisted suicide in a state, go to a state where it was legal. Instead, he and his wife, he had been given a few months to live. He and his wife had a baby during that time, where he chose to live and get treatment and see what happened. And he eventually did succumb to the brain cancer. But they had a child in the meantime. They had time together. The older son got to know his dad in ways he wouldn't have otherwise. And JJ was such a clear, beautiful voice, speaking against assisted suicide. And so I kind of hope, we Catholics think of intercessors, people in heaven, kind of rooting for us and knocking on God's door and being like, they need a little extra help here. And so I imagine our Marine JJ is doing that right now.
I think one thing that unites all the stories you just told is this culture of encounter, a public encounter that we were able to have with these different folks. And um, that's the opposite, of course, of what we tend to have, which is a throwaway culture where we push older people, we push people with brain tumors, we push people who are declining away so we don't have to encounter them. We make them easier to discard. We make themselves feel like it's easier to discard themselves, right?
Yes, yes,
Instead
yes.
of instead of having these encounters with others, they are sit in front of a TV all day, or maybe at best now have an AI powered robot to interact with them. Um, what the gift of all three of these folks you just mentioned that they gave to us is, and to our culture, is to say, we're not downplaying some of the challenges here. There are very significant challenges here, but we can live flourishing lives. We will live flourishing lives if we are in the right context, in the right culture. Um, and that's what a big part of my forthcoming book is about. It's if we can show what it's like to live well in these contexts, and that it's not this unbelievably scary, awful thing that is just going to put me in isolation, away from everyone, where I just waste away into nothing. There are lots of people who choose to live the kind of lives that you just articulated. Lots of people. In fact, this is a very much a Western consumerist phenomenon in most developing countries. This is a totally absurd idea. The fact that you would push your elders off into a culture cut off from a society and think about even killing them is even more absurd. Um, and that's what I think we need to focus on. How can we continue to tell stories? How can we uplift stories of people who are having challenges? No doubt, don't want to downplay that, but are leading flourishing lives in relationships of encounter and hospitality with others.
There are, when you think about the whole spectrum, the beginning and all of life, um, we're so much of our social media culture, especially, it's been commented on much, very much, is about showing the best, right? So the best picture you managed on Easter Sunday of you and your kids, right? The one time your little guy wasn't screaming, right? You usually don't. My one of my dear godchildren, Noah, I tell his mom sometimes, Kristen, post a picture when he's being a monster every once in a while, just so people know he actually isn't an angel. Yes, he's adorable, but he's a monster too. And um, but I jokingly say that because the reality is most of us are suffering in some way, in many ways, in many cases, and a lot of what this culture of encounter that Pope Francis was talking about was just like getting to know people, or at least appreciating there's more to the story than we know, more to the story than they let on when you say hi, how are you, and you don't really have time to find out how how you're doing, you know and the idea, we could talk for ages about the idea of suffering, and there being something redemptive about that, right? But even more so, I'm always moved. We've had conversations with Sister Constance from the Little Sisters of the Poor out of DC, and she's been a little sister for 2 decades, and she says that she's never been in a situation where someone has begged to die, because they were in such pain or they were so desperate, because the little sisters who their specialty is treating the elderly poor, um, people in their care are loved. I mean, I know I stay with the little sisters every once in a while, just so I can visit, frankly, with Sister Constance and have somewhere to stay, that isn't an exorbitant DC cost. And they treat you like you're a king or a queen, because they value life that much, because they see Christ in you. And that picture that, I think everybody knows, of Pope Francis, embracing the man with the deformed face, not knowing what he had, if he was contagious, um, that is him seeing Christ in this man and seeing beauty in this man. And yeah, again, assisted suicide, abortion, it's the opposite of that embrace. And we I have my "we will help you" sign. That's both an invitation and a challenge. It's, please, no, to anyone who is pro-choice, or anyone who is in a situation, could be in a situation of an unplanned pregnancy. There are resources. I mentioned Jarrell from Heartbeat International. He represents over 3,000 pregnancy care centers around the world, but US 3,000, over 3,000. There are places, there are people who will help. And as you were talking about earlier, Charlie, we're aware and we advocate for, resources, both private and public. And I saw Arkansas just had, a batch of helps that they passed, to women. Yeah, so the "we will help you" is also a challenge to pro-lifers. We need more. It's not enough to have a talking point. Oh, we have over 3,000 pregnancy care centers. Do you know about the one closest to you? Is the question I always ask pro-lifers. Do you know where the closest maternity home is? Do you know where the closest pregnancy care center is? Do you know if a mom came to you and said, "I need help with housing or work," or, would you have any idea what to say to her? You know, that's part of the challenge as we go forward, because as we make clear that the abortion pill isn't safe for women, at the same time, we have to be putting forward those resources, and letting women know that they're not alone, and letting men know too, that they're not expected to take her for an abortion. There's a better way, to be a man, to step up to the plate and be a father. And as you alluded to earlier, sometimes that means parenthood is adoption, an adoption plan, which is a whole nother conversation, but an important one in this context. And somewhere I'm not going to move the right way, but I have a foster care. This is like the March for Life remnants in my office, but that's a whole nother, and next month is foster care awareness month. So I will be highlighting some things, and I know that's also an issue close to your heart. So this is kind of a grab bag of pro-life things, and you got to go be pro-life and be a dad. um, but thank you, Charlie. And Charlie, any sort of just last words here at the end of April, thinking about the culture of life that John Paul II talked about, and the culture of death that we're trying to combat in so many different ways. I like your optimism, and I don't think it's a Pollyannish optimism about assisted suicide, because the more people see, and people think I'm making up Canada when I bring up some stories, and Wesley Smith is, so great about chronicling, what's happening in Canada in terms of assisted suicide. But I think when people know, then we have a fighting chance.
I think, and this is rough for a professor to say, who's focused a lot of time on making arguments and marshaling evidence. One of the hard lessons I've had to learn over the years is that storytelling, telling better stories, is a far more effective tool for helping advance some of the things we've been talking about here. Then you got to get the arguments right, you got to get the evidence right, but storytelling has to be a central part of this. And so much of the story that's told in our culture, our use and throw away consumers culture, is we got a bunch of people who are autonomous monads who are making choices, and this is just another choice for them. If we can dive into a culture of encounter and hospitality, welcoming people into our circles and get to know the stories of the kind that you just mentioned, to thicken out the stories of people, both at the beginning and end of life. One of the main things that we learned about people with the abortion pill, women with the abortion pill, girls with the abortion pill, is the number of times that they're either explicitly or structurally coerced into abortions they don't want to have. Sometimes the pill is literally dropped into their drink by somebody who is trying to, do that kind of violence on them. Other times it's more subtle, like the example of Louisiana, where the mother got the abortion pill from a doctor in New York, and her daughter was about to have a gender reveal party for the baby, and she coerced the abortion for her daughter. I mean, those are the thick stories that we need to tell at the end of life. If we talk about people who, again, don't have the resources of little sisters of the poor, but again are being coerced in situations they don't otherwise want, we need to be telling those stories, and there are great groups doing that, live action, plenty of others, but we need to do a better job of telling these thick, detailed, encounter filled, hospitality filled stories. That's the way we're going to advance the culture we want to advance.
And the fact of the matter is, women are capable of amazing things if people will just walk with them. Human beings are capable of amazing things. And I don't think men know what they're capable of, and that women want them to step up to the plate. Which obviously there's so many layers of a cultural needs there. But the Knights of Columbus have a great was it into the breach, a great series talking about what is manhood and what is fatherhood, and it really is about a lot about the hospitality and the protection. And we think of Saint Joseph, and I often think of Saint Joseph and Saint Michael on the day that Pope Francis and Pope Benedict consecrated the Vatican and the Holy See
That
to
was so
Saint
great.
Joseph and Saint Michael. And even if you're not Catholic, yeah, I think you have a sense they're protectors, and we're obviously dealing with both evil and the need to protect the vulnerable. And so I always bear them in mind. So anyway, Charlie, thank you for the work that you do. Charlie Camosy, take a look, just Google him, and you'll see a slew of things, including probably in a day or two something appealing to Kathy Hochul in New York, asking her to say no to assisted suicide. It's the right thing to do, and it is the move that would honor Pope Francis, honestly. Thank you, Charlie, for everything you do.
Thank you, Kathryn. I really appreciate it.
And thanks everybody for listening. We'll have more of this kind of thing at National Review and National Review Online. Bye.
Bye bye.